Hey guys, welcome back to DOCSHAALA. So in this video, we are going to see about Rifampicin from the subject pharmacology. So NEET MDS question was asked from Rifampicin in the previous exam. So let's see what it is. So Rifampicin, so you know it is a class of drug which we use in tuberculosis drugs, right? So it is an antibiotic which is used in treat several types of mycobacterial infections. So that is Mycobacterium avium complex, leprosy, and in combination with other bacterials to treat latent or active tuberculosis. Okay, so it is a semi-synthetic antibiotic produced from Streptomyces mediterraneae. So this is important. So keep in mind. Then what is the pharmacodynamics behind this rifampicin is that so it acts by inhibiting the DNA dependent RNA polymerase activity. So it acts by inhibiting the DNA dependent RNA polymerase activity in susceptible cells. So specifically it interacts with the bacterial RNA polymerase but does not inhibit the mammalian enzyme. Okay, it does not inhibit the mammalian enzyme, but it acts specifically with the bacterial RNA polymerase. Then it is bactericidal. Okay, so it is bactericidal and has a very broad spectrum activity. So it is active against both most gram positive and as well as gram negative organisms. So these include even Pseudomonas aeruginosa and specifically Mycobacterium tuberculosis. Okay, so the because of its rapid emergence of like what it happens is when it reacts with these bacteria, what it creates is it rapidly creates resistant bacteria. Okay, so because of this creation of resistant bacteria, so it is only used in certain infections. Okay, what happens is if it is creating many resistant bacteria, what happens, it will not work for even the disease that we are using it for. So that is why it is only specifically used in to treat a few infections only. Okay, so it is well absorbed when taken orally. So and it is also distributed widely in body tissues and fluids including the cerebrospinal fluid. Okay, so it is metabolized in the liver. Okay, and is eliminated in bile. So, okay, and to a much lesser extent in urine also it is eliminated. Okay, then coming to the mechanism of action, as we have discussed, it inhibits DNA dependent RNA polymerase, which leads to the suppression of RNA synthesis, which further leads to cell death. Okay, then what is the drug interaction with OCPs? OCPs or BCPs are nothing but birth control pills. Okay, so we are going to see it actually rifampicin reacts with various other drugs, but we are not going to see interactions with all of them. We are only going to see the interaction, how it interacts with birth control pills. So what are birth control pills made of? So a common birth control pill is made of two hormones. Okay, one is estrogen and other is progestin. Progestin is nothing but a steroid hormone, okay, which is created. It is a form of progesterone. Okay, it is a steroid hormone which is created. Progesterone is secreted in the female body, whereas progestin is something which we artificially created. Okay, so it is linked to menstrual cycle, pregnancy, and also in development of embryo. So it is an artificial form of progesterone. Okay, so the metabolism of progesterone can be increased. So what happens is this progesterone metabolism increases when it is combined with rifampicin. Okay, this is the main point which you need to keep in mind, that is the metabolism of progesterone. That is when we give rifampicin in females, what happens is the progesterone metabolism increases. So when all we see spike in progesterone is when the female is undergoing any menstrual cycle, or when the female is pregnant, or during the development of embryo, that is during the child bearing stages, we see this progesterone hormone naturally spiked in females. But when we combine it with rifampicin, the progesterone can be artificially spiked. So when it is artificially spiked, it might cause a few side effects in females when we are giving it during these times, especially because now naturally it is spiked, but when we are combining it with the artificial spiking also, what happens, it will spike double the dosage, so there will be a side effect. So what is the side effect? Let's see that. So the adverse effects, these are the common adverse effects which we see with rifampicin actually. Okay, so they include heartburn, abdominal pain, loss of appetite, nausea, vomiting, jaundice, cramps, diarrhea. So this we see with any other drug. So elevated liver function test. So this is important. So elevated liver function test, which results in hepatitis, is also seen in rifampicin as a rifampicin adverse effect. And there might be deficiency of platelets in the blood, and also discoloration of the skin is also seen. Okay, so a question was asked in NEET MDS. So let's see the question. So a patient is on an anti-tubercular drug. So they are not specifying which drug she or he is on. So the patient takes oral contraceptives. Okay, so that means she's a female, but still she got pregnant. So even though while she's taking oral contraceptives, she's on anti-tubercular drug, she got pregnant. So what is the reason for this? So the reason is she has been given rifampicin. Why? We have seen rifampicin results in spiking of progesterone, right? So a female becomes pregnant when there is spike in progesterone hormone. Okay, so what happens is this contraceptives do not work when we are combining it with an anti-tubercular drug such as rifampicin. Okay, this what it causes, rifampicin by itself causes elevated progesterone levels. While on rifampicin, if she's taking a oral contraceptive also, there are chances that the female might get pregnant. Okay, so the correct answer will be rifampicin. So I hope you're clear now, right? So if you like our video, do subscribe to our YouTube channel. You can also follow us on our Instagram handles at DOCSHAALA for dental content and at DOCSHAALA Medical for medical content. You can also follow us on Telegram. Thank you.